Ergonomics is the science and art of fitting the object and the activity to the person, not fitting the person to the workplace. It holds the answer to preventing and reducing pain and improving productivity. How you position yourself and move when you sleep, when you sit, and when you lift will determine how likely you are to hurt. The hurt that one feels with poor ergonomics is a buildup of toxins in your muscles, strained tissues, or torn tissues. In this ergonomic series, I will show you how to prevent getting hurt by teaching you the way to properly position and move your body during sleep, sitting, lifting, and other common activities. Like most chiropractors, neurologists, and primary care doctors, I see patients often that have headaches, shoulder pain, lower back pain, hip or knee pain, and more. The aisles of stores are lined with self-prescribed drugs that allow you to cover up the discomfort long enough to get done what you need to get done, or just get to sleep, then redose yourself again later until your body heals itself or just compensates so that you don't notice it anymore. Most doctors, having little education in treating conditions of the muscles and joints, only have similar medications to provide pain-suppressing, inflammation-suppressing, or muscle tension-suppressing causes as a solution. Chiropractors tend to look further toward the cause of what's making you vulnerable to pain, the dysfunction of the spinal joints or imbalance or weakness of the muscles. Often it's necessary to address that vulnerability, but there is a cause that's even more primary, your ergonomics. In fact, poor ergonomics not only cause pain, they prevent you from recovering. That's why education is such a big part of my practice. The most common body areas that hurt because of poor ergonomics are the head and the neck, the shoulders and arms, and lower back and thighs. Wow, well that's almost the whole body, right? So when these body parts hurt consciously or unconsciously, it also leads to poor productivity for work or school. I'll explain how poor ergonomics causes pain later, but for now we'll accept that it does cause both conscious and unconscious pain. It's important to recognize that much of the irritation is being received by your brain even when you're not aware. In neurology, we call this irritation nociception. It doesn't become pain until our brain becomes consciously aware and interprets it as pain. With postural toxic buildup, our brainstem is receiving these irritating nociceptive signals and relaying signals to our blood pressure, heart rate, and respiratory rate control centers of our nervous system. So our physiology is often stressing out even before we know it. This can wear you out as the day goes along. Ever felt more worn out from the day of sitting than from moving around all day? Think about it. Those nociceptive centers also relay that unconscious irritation to your amygdala. This is the part of the brain that helps determine if your environment is dangerous or not. After making some assessments, it sends the message to the conscious brain, and the problem is that the message is not clear. There's no context of why there is a concern. This may cause emotional stress. In susceptible individuals, it seems to trigger anxiety. Any of that will wear you out and tend to make you less focused and productive. And it will feed the cycle of more tension and strain in the tissues that are sending nociceptive signals in the first place. So the point is that ergonomics are important, and by handling them well, you can help prevent and more quickly and completely resolve pain and injury. This is Dr. Hobbs signing off from Synergy Chiropractic and Natural Health. You can visit us at ViseliosSynergy.com. May God bless you and have a wonderful day.